here in Atlanta out of our Caron Atlanta office, where we offer intensive outpatient programs for teens, adults, families. So we would love to connect with you guys if you need any more information after the presentation today. Just to give you a little bit of information about our format, we will hear a presentation from Dr. Blank, and then we will open it up for questions and discussion. We want it to be as interactive as possible. So if any of you guys have questions, feel free to use the raise the hand option. It should be at the bottom of your screen. And you can also type in the chat box if you have some questions, and I'm happy to ask Dr. Blank those questions. So let me get started by introducing our speaker, Dr. Blank. She is our medical director at Caron Atlanta. She's also the founder and chief medical officer at the Atlanta Healing Center, which is located in Norcross. What I can say about Dr. Blank is not only is she an expert on the subject of marijuana, but she has this gift of explaining high-level, complex information so that someone like me can actually understand it. And someone that doesn't have a medical degree can actually regurgitate it to patients and families so that we can help more people. So with that, I will turn it over to Dr. Blank. Thanks so much for being with us.
Thank you so much, Martha. I appreciate it very much, and I appreciate all of you taking your time. I just realized I'm in a roly-poly chair, so I'm going to have to keep reminding myself to sit still. During the presentation, I'm going to turn my video off so that you will have better access to see what's on the slides, but also that seems to improve the quality of the audio. If there is any problem though, please do reach out via the chat box. If you can't hear, if we're going in and out, let me know so that we can do whatever we need to do to adjust it. So I'm going to say bye-bye and turn this off for 1 second. And actually I want to hide that screen. There we go. All right, so let's go ahead and get started. These are my disclosures. Nothing, no one's paying me anything from the marijuana institutes or big tobacco, so I can clearly say that is not part of my presentation. I'm going to spend a little bit of time on this particular slide because this is going to be, I hope, really helpful as you begin to think about all of the different products that you're seeing on the market, all of the different products that your family members, patients, neighbors may be using. And today, since we're in Georgia, and I am making an assumption, which may not be correct, but I'm going to make the assumption that we're actually in Georgia. So much of what I'm going to say is going to be more Georgia specific. If there are questions about other jurisdictions, we can address that a little bit later. But the most important thing is to understand that cannabis is the genus name. So back in biology, you remember learning about genus and species and phylum and all of those kinds of categories that show relationships in families. So genus is this flowering plant, and there are 3 species under the family name, the last name, if you will, cannabis. So we've got cannabis sativa, cannabis indica, and cannabis ruderalis. So these are the 3 main categories of cannabis plants. This particular slide, I think, is helpful, though busy. It shows the relationship between these 2 common, not scientific names, but slang terms for products that you might be seeing or that you might need to talk about with your family or friends or patients. So we have marijuana, again, not a scientific name, and it refers to a cannabis plant. Generally, when people are mentioning marijuana, they're thinking about the psychoactive effects and so on. Then we have hemp. Hemp is also not a scientific name because both of these particular plants are of the family cannabis. They're the exact same plant for all practical purposes. So that is a big, important distinction to understand, that it's a distinction without much merit. So both of these products, whether we're talking about marijuana or talking about hemp, they both produce cannabinoids. There are 400 cannabinoids in these plants. Some of them are very psychoactive. Some of them have activity in the body and have a role in homeostasis, or keeping our body systems regulated. They also have the terpenes, both of them do. This is responsible for some of the smells that you might associate with these products. It also has to do with some of the subtle nuances. But the important thing is that both marijuana and hemp are the same plant in many ways, and they both have these characteristics. Now, in order to have a legal name of hemp, it has to have the THC, which is the tetrahydrocannabinoid, of less than 0.3%. That's what makes it defined as hemp. So very low psychoactive properties. Hemp, of course, originally came to this country to be used in making fabrics and ropes and paper. And so it has been a part of North America for probably as long as any of us can remember. But it's, in order to be defined as hemp, it has to be less than 0.3% of the psychoactive marijuana, this particular cannabinoid. The interesting piece about this, for those of you who do live in Georgia, is that our low, and I'm using air quotes, though you can't see, low THC oil that is permissible with a marijuana card here in Georgia is 3%, which is actually the highest in the nation. It is not low THC. That is a fairly good amount of psychoactive THC. Back in 2018, there was an Agriculture Act that was passed by Congress that allowed the growing and distribution of hemp and hemp products without any regulations, without any legal control on it. This was very important. This is part of strategy, in my opinion, that is allowing us to become more accustomed to the idea of having marijuana products grown and having them distributed in states which currently that's illegal. So again, hemp is derived, can have CBD. This is the thing that you can buy at Bed Bath & Beyond, that you can click and find products on Amazon. It's legal if it contains 0.3% THC or less. So if it is hemp from the hemp plant and it has a very low THC level, then anything derived from this, whether this is hemp seeds, whether it's makeup, whether it's topical preparations, whether it's food or additives to different preparations, as long as it is from hemp with a low THC, then all of that is legal. It can be shipped, it can be sold, it can be purchased. You can have it on your person, in your car, in your wallet. Well, probably not your wallet, but maybe your pocketbook. Now, if it is derived from a marijuana plant and it is labeled as CBD, it does not matter how much THC is or isn't in there. It is illegal. And this is a very important distinction and very important in legal settings for people who are marketing and distributing these products. So if it's CBD that comes from the marijuana plant, doesn't matter how much THC is in it, it is illegal because marijuana is illegal. Now, in all honesty, it is extremely difficult to get very low THC products. And it is extremely difficult to have products that are manufactured and that are in any way being monitored by the FDA or other regulatory agencies. We just don't have that, and that oversight is not very good. So there may be some products that are very well manufactured, lots of quality control, eliminating contaminations and other kinds of problems. But for the most part, these are not the products most people are getting. They're being manufactured in small production plants or in someone's backyard. And it is much more difficult to have a good, high quality product. But this is important for you to know and understand so that you can, again, be more educated about your potential use or people around you. Excuse me. So one of the things that has been very interesting to me throughout this whole process of the so-called medical marijuana legalization is that since 1985, we have actually had 2 FDA approved medications that are produced by pharmaceutical companies, dispensed upon written prescription by a physician, and given to you by a pharmacy. These are well controlled. You know exactly what's in them. You know how they've been prepared. They have very high standards of quality. And we know the dose you're getting. We know what are the indications for it. And we know very clearly side effects and drug-drug interactions. Unfortunately, no one wants this form of marijuana, even though this is actually THC. This is not the CBD. This is psychoactive THC. The FDA approved about 2 years ago a pharmaceutical made by GW Pharmaceuticals, which is a company out of England, and they approved CBD. Now, this is the one and only pure CBD product. I don't care what they tell you, what's written on the product, what the salesperson or whoever tells you. There is no such thing as pure CBD that is not Epidiolex. Part of the difficulty you need to understand is that people taking CBD products actually will have positive urine drug screens for marijuana. This may not be a problem for many people, but it can be a problem for some. So this product was FDA approved, and it is approved for 2 specific conditions: Lennox-Gastaut seizure disorder and Dravet syndrome. These are 2 seizure disorders that are found in infants and young children. These, again, like the 2 that we had before, the Acecament and the Marinol, they're written under prescription by a physician. Now, if you're getting a marijuana card, that the recommendation, not a prescription, because physicians cannot prescribe CBD or medical marijuana products. That's illegal. But they can write a recommendation, which you would take to the state authority, and they would issue a medical marijuana card for which you could then go in the state of Georgia, have access, if you can find it, to the 3% THC oil. But this particular medication, like the 2 in the previous slide, are written by physicians, dispensed by pharmacies, and covered by insurance. This is an oil. It is given using these little syringes. They don't have a needle on them, but you measure it up according to the dose written in the prescription by the physician, and you apply it under the tongue. We're going to talk a little bit more about some warnings that have come out regarding the CBD oil in a minute. So why would any of these chemicals have much activity in our body? And that's because we have endogenous cannabinoids. The reason that opiates, pain medications, have action in our body is because we have endogenous endogenous opioids. So we have opiate receptors for the endorphins that our brain naturally produces. We also have endocannabinoids. They're made by our body, and we are going to be looking at these. We can see anandamide and 2-arachidinalglycerol. I'm just going to call that 2-AG. This is what they look like in their physical structure. This is what marijuana looks like. So you can see not exactly perfect match, but close enough to be able to activate both of the body's natural receptors. We know that THC and CBD and the hundreds of other cannabinoids mimic many aspects of the arachidonic acid and the 2-AG. So we need our endocannabinoid system. Its role is to keep our body in homeostasis. We want to be balanced. We want to have the right mixture of sleep and appetite. We want to have energy, all of these functions in our body. We want to have just enough, not too much, not too little. And so the role of the endocannabinoid system is to keep us in that balance. This slide shows some of the many different functions that the endocannabinoid, our natural endogenous endocannabinoids, have effect on. This is one of the reasons that many scientists and other researchers have gotten excited about the possibility that we may be able to use subsets of the marijuana, the cannabis plant, to help with problems related to appetite. Most people are aware when folks smoke pot, they're going to get the munchies. So there is some regulation of appetite, of sleep, of pain, mood, movement, memory, learning. All of these things are affected and have cannabinoid receptors. And so these are the areas of inquiry that we're going to see more about. With the FDA approving Epidiolex, now that we have a pure CBD product that we can study, we can have double-blind, placebo-controlled studies, we're going to really begin to see what is the actual effect of these substances on different metabolic functions. So we have two CBD receptors. We have CBD1, and these receptors are found primarily in the brain. They influence things regulated by the hypothalamus. The hypothalamus regulates our appetite, regulates our sleep-wake cycle, and they also play a role in memory and emotional processing. We also have some CB1 receptors that are found throughout our body, and when they are activated, we know that they do reduce some of the sensations of some types of pain. Now we have CB2 receptors. These are mostly found outside the central nervous system. There are some in the brain, of course, but these are mostly in the nervous system that we call the peripheral nervous system. Their primary job seems to be in controlling inflammation and reducing inflammation from injury, illness, or other metabolic processes in the body that have gotten a little bit hyperactive. There are many disorders that we know are associated with underactive immune system or an overactive immune system. So again, there may be some hope for these particular products made from cannabis that could be helpful in inflammation and immune problems. This just shows you the areas that are pink are the CB1 receptors, and the blue are CB1 receptors, and the pink are the ones that are the CB2 receptors. Both of them, of course, have some location in the brain. This is an important picture to get some idea about where do we have receptors in the brain, because this is where we're going to see a lot of the psychoactive functions as well as some of the metabolic functions. So these little pink dots, and I apologize to any of you who may be red-green colorblind, but we see in the prefrontal cortex, we see them in the sensory motor strip, we see them in the parietal lobes, in the occipital lobes, and very importantly, we see a lot of them in the cerebellum. Now, the cerebellum is in the back of your brain, and we used to think that this was just important for balance and coordination. However, we know now that it has a lot to do with how quickly we process information and how quickly we are able to gather information, put it together to make a decision and take some action. Most of the time we thought, and still think, that things like ADHD and ADD involve the prefrontal cortex, particularly on the left-hand side of our forehead. But we know now that there are also some things that happen here in the cerebellum that may have issues related to attention and focus. Oops, I didn't want to go there just yet. We have the cingulate gyrus. This is the gear shifter of our brain, and hopefully it's, for most of us, shifted so that we're in our prefrontal cortex. We're thinking, we're learning, we're communicating. But if a tiger were to run into the room, then it would shift it back here so that our hippocampus and our amygdala could help us run and hide or stay and fight. So this gear shifter is very important. And we have this memory center, also very important. The hippocampus and the amygdala, our burglar alarm system, and our long-term memory. This, of course, is the ventral tegmental area and the nucleus accumbens. These are the two places in the brain that release dopamine, that pleasure chemical that rewards us for doing what we need to do to stay safe and to continue the species, but also in people who are genetically predisposed, they'll have some issues here, and we call that the disease of addiction. So let's talk about how marijuana affects the body. When it is smoked, and again, that's not the primary mode of use that is recommended by most people for medical conditions, but if it's smoked, it passes very quickly into the lungs and then very quickly up the carotid arteries into our brain and releases very quickly into our brain and has very rapid onset of action. The effects are immediate and last about 1 to 3 hours. Excuse me. So what about edible marijuana, or marijuana that is taken by mouth or absorbed through the skin? If it's in food or drink, then the onset of action is slower. This is what's caused a lot of problems for marijuana tourism. So those counties and or states that have allowed marijuana for recreational use to be legal, many folks who might not have used marijuana before would choose a gummy, an edible, a soda that has it in it, and they would eat a part of the cookie or the brownie, and they'd wait a few minutes and they don't feel anything, so they're going to take a little bit more, and that one brownie that was probably a serving for 4 people or 8 people, they may consume the whole thing. And now they have a very, very high level of activity because it takes half an hour to an hour for it to be absorbed and take action. This type of marijuana use, though, or CBD use, usually lasts longer, and that's why it's preferred that it be taken in an oil either that is swallowed or absorbed under the tongue. I do have to let you know that there are also preparations that are topical. If you've got an achy joint or a sore back, you can apply these CBD, and I'm again using air quotes, CBD compounds, and they're absorbed through the skin. I have to tell a story about one of the healthcare providers that I monitor for the medical board. She was within a week of being through with her 5-year monitoring contract when her dear friend gave her some hemp products, some makeup that she was using, an oil that she could rub on her back, and a juice that she was to drink to help her lose weight. Well, even though her friend had assured her there was no THC, this was 100% CBD, not so. She failed a drug test because it was positive for THC. That is not a false positive. It's real THC, LCMS verified. And her contract with the licensing board was extended. This is real. She didn't think she was doing anything wrong. However, she did have some fairly significant consequences. So it can be absorbed through the skin, can be absorbed through the stomach, and it can be absorbed through the lungs. Well, let's look at what is some of the scientific evidence. Let me just preface this whole next series of reports by the fact that lack of evidence is not the same as no evidence. So please keep that in mind. There were 2 studies, systematic reviews done by the United States Departments for Veterans Affairs, looking at chronic pain and PTSD, very common ways in which people are using either CBD or hemp oils, maybe using medical marijuana itself. And they found there is not enough high quality scientific evidence to support the use of that. So for anxiety disorders or chronic pain, we don't have evidence, and these were very large studies. When we look at dementia, this was one of the categories of illness or impairment that is allowed here in Georgia for the use of the low THC, and again, it's not low, THC oil. Dementia was one of the new ones that was added. Unfortunately, what they found was that not a very good study, poorly designed, and there was not enough data to really show any useful conclusions. This is part of the problem, and as we have moved medical marijuana outside of science and outside of usual rigorous study, and people are using this on their own, there's probably not going to be as much research done as we might like because there's really no money in it, and you always have to follow the money. That's an unfortunate consequence, unforeseen consequence of taking marijuana and making it medical, but outside of the field of medicine. This is an interesting problem to understand, that when you smoke marijuana, it does not increase your blood pressure, but it does increase your heart rate. usually about 70 beats per minute on top of your regular heart rate. So you can have your blood pressure, or excuse me, your heart rate go very fast. And because of this, you're getting decreased blood flow to the lungs and to the heart. Studies, one study has shown that you have an increased risk of heart attack within an hour of smoking marijuana, 4 times your usual risk. Well, people who are young and healthy and don't have coronary artery disease aren't going to have much problem, but someone who does have heart disease, this could be very problematic. This was the new warning that was added to the Epidiolex, the pure CBD medication that was developed by GW Pharmaceuticals. So researchers at the University of Arkansas found that mice given CBD oil showed liver damage within 24 hours. 75% of the animals tested died or were on the verge of death within a few days. None of the CBD products were being sold in grocery stores and malls all over the US have FDA approval. The only CBD-based medicine that has been approved, Epidiolex, now has a warning about dosing slowly and very carefully following the liver and liver enzymes to make sure that there is not some damage. Fibromyalgia is one of the indications, and again, Cochrane, for those of you who are not familiar with this is where everybody goes. If someone quotes a study or a finding of something, the common question asked in medical circles is, well, what does Cochrane say? The Cochrane reviews look at medical research all around the world in every language, and they put together these very important reviews and recommendations for treatment. They looked at fibromyalgia, and again, not enough high quality evidence available to draw any conclusions. Lack of evidence is not the same as negative evidence, but it just shows you that we're having a lot of difficulty backing up many of the claims that are made. We do know that studies done at the University of Buffalo and that have been reproduced and continued showed that men who smoke marijuana have a significantly lower amount of seminal fluid with lower sperm count. And what sperm they do have behave abnormally. Sorry. We also know that marijuana is stored in the fat cells. That's why we see drug tests for our patients who have been regular consumers of marijuana be positive for weeks, sometimes even a month or more after they've quit smoking. So this greatly adds to the problem, both for the brain and also for the production of sperm. So this is going to impact infertility. There are other ways in which drug use impacts fertility that have to do with the pituitary gland. That's another story for another day. So we do have some information that does give some minor support, and this is from the American Academy of Neurology regarding multiple sclerosis. So they were using oral cannabis extract and the synthetic cannabinoids like Marinol or Sesamet. And they found that they're probably effective for reducing patient-reported symptoms of the spasticity and pain, but not the tremor of MS. And when the physician looked at the level of spasticity, they did not see any improvement, but the patient did subjectively report improvement. The Sativex oral spray, another GW pharmaceutical product, which is marijuana, was found to be probably effective for improving patient-reported symptoms of spasticity and pain and urinary frequency, but not bladder incontinence that is associated with marijuana. The MS tremor and spasticity were not actually seen by the physician, the treating physician. There was a question that came in earlier asking about anxiety and depression. Also a question about cannabis-induced psychosis. This is one of the difficulties that we have. We don't know because we don't have genetic testing on many of our patients. But the COMT enzyme is the enzyme in our brain that breaks down serotonin, norepinephrine, and dopamine. There are some subsets of these that are abnormal. Now, MET, this is the most common one. And when we look at people who have never smoked marijuana versus those who have, we see some difference. But when we look at this val-val combination, so these are the two separate genes, one from your mom, one from your dad, we see that the schizophreniform illness is diagnosed before the age of 26. We see psychosis greatly associated with those people who have used marijuana. And this is one of the things that we worry about, that genetically we do have people who are vulnerable to psychosis. These people are more likely to have issues related to hallucinations when they use it. And we are able to see that there are these problems and they're genetically inherited. So high doses of the drug can cause this toxic psychosis. When people are using cannabis in food or drink, they're more likely to get this than actually when they are smoking it. So I know I've gone way over time and I apologize. We'll turn this over in 1 minute. Just though wanted to give you information about the second part of the series, which has to do with how do we talk to our patients and their families about marijuana, and that will be next week, same time, same station. So with that, I'm going to, and these are your regional representatives if you need more information. And here's our Martha right here. Everybody write this down. It's not her home phone number, but close enough. So I'm going to stop the share and I'm going to turn my camera back on.
Wow, thanks, Dr. Blank. I've heard you speak on this subject, and every time I learn something new, so I really appreciate it. Wanted to turn it over to our audience and see if anybody has questions or comments. We'd love to hear from y'all. We have a good 20 minutes left. So anyone that might have a question, feel free to use the chat, or you're welcome to raise your hand and we'll give you audio. And also we can see your pretty face if you so choose. So does anyone have any comments or questions? Dr. Blank, I'll start us out with a question. Are there any places such as websites, books, that you would recommend that we could point people to that have some research-backed information? Just any insight into that would be really helpful. Oh, you're muted, Dr. Blake.
You mean you can't hear me? Can you read lips? So that's a really good point, Martha, and thank you for bringing that up. There are a number of really good resources that I think provide good, balanced, and scientifically based information. One is the National Institute of Drug Abuse, NIDA, NIDA.gov. It's part of the National Institute of Health, and they have a lot of really good information. And there's a tab along the side on the left-hand side of the screen when you go to that website, and you can see marijuana. So that's NIDA, NIDA.gov. Also, Substance Abuse and Mental Health Services Administration, the SAMHSA, S-A-M, let's see, okay, I'm going to do this wrong, SAMHSA.gov, SAMHSA, I always want to mix the S's up, .gov, and they have a lot of really good information. Some information that I think is good, but has a very anti-marijuana focus. So just give you that, a little bit of a bias, is the SAM, Smart Approaches to Marijuana. That's sam.org. And that's got some very good information about car accidents, marketing around marijuana, the effects of marijuana in different states that have been using and had legalized marijuana, and how is that affecting youth, how is that affecting hospitalization rates, and so forth. Again, they're very anti-marijuana, so I'll just tell you that, but their information is very good and quite interesting.
Great, thank you. And I think you did a great job of covering this, but I just wanted to see if maybe you could give us a few takeaways from this question. So I always hear about marijuana use being really risky for the younger population because of their developing brain. Are there some risk factors that adults should be aware of? I think that our society just kind of pumps into the general information that it's really kind of risk-free if you're a healthy adult. So are there just a few pointers that we could keep in mind when discussing it with the adult population?
Again, another good question, because I do think people tend to think that I'm an adult, I'm healthy. And, you know, again, just like most people who don't have the disease of addiction, the problem is not, with substances, is not the substance, it's your brain. But just like there can be problems for people outside of addiction who use alcohol or who take their pain medicine inappropriately. So with marijuana, we have a number of problems. First of all is, as we talked about, that increased heart rate. Just like we see holiday heart, which are people having heart attacks on Monday after they've had a weekend of heavy drinking. When you use marijuana, you're at risk for having a heart attack or a cardiac arrhythmia if you have some underlying heart disease. And frankly, most of us don't know we have heart disease. We have the risk of damage to the liver. That's actually increased a bit more particularly with smoked marijuana, because now that it's become a big business and it's not Bubba Joe who's grown it in the backyard and you've bought it from him for years, but now that it's big agriculture, they're using pesticides, they're using fertilizers, they're using products that become difficult for your liver to metabolize. And we do know that most adults are on at least one or more prescription medications, whether that's for their allergies or their asthma or their blood pressure. There are a lot of drug-drug interactions that happen with marijuana because it competes in the liver for the same metabolism. And now suddenly your medication that was normalized, the levels can be much higher or lower depending on the interaction. And so now you can start having side effects and problems with your medications that you weren't expecting. There are problems for people that don't know they have the COMT dysfunction, and suddenly they can begin to hallucinate and have some difficulties that way unexpectedly. We know it does affect our reflexes. Therefore, our balance, our reaction time, if we're driving, is impaired. So people who are using marijuana when they're driving, when they're working with heavy machinery, they are much more prone to have accidents and have injury. Again, doesn't mean they have the disease of addiction at all, but there are health risks, some of them pretty clearly known, some of them will be revealed as we go along. But I think the other piece, and particularly for people who are using CBD or hemp products, who truly don't believe there is marijuana in it and would not normally use marijuana, one of the risks is people might be going for a job interview and have to do a drug test. They have a positive test for marijuana. Now, the employer is not going to tell you that you failed your drug test and so they're not hiring you. You might not know that. If you do have random drug screens at your work because you're a drug-free workplace, again, you might show positive for marijuana and put your job in jeopardy. If you're driving and you have a motor vehicle accident and they do a sobriety test and now you have marijuana, you could have a DUI. So there is an impact for you potentially financially and in the employment world that you might not have thought about.
Great, thank you so much. And we got a question from Jonathan. Hi, Jonathan. What about long-term effects of increased THC levels as they have gone up rapidly over the last 10 to 20 years and more acceptance among general public and brain development?
So this is what really scares me. Back in the day, many, many years ago, when we were still using stone tablets and I was growing up, the level of marijuana, the level of THC, the active psychoactive compound, was around 4%. Remember, in Georgia, low THC is 3%. So that got us high, that got us into some troubles back in the olden days. But now we're seeing regularly marijuana being cultivated 15, 20% THC. Then when you begin to see people making oils out of it, and then burning off the oil to leave almost 90 to 99% pure marijuana, pure THC, we are seeing people having very difficult reactions. There's a new syndrome called the hyperemesis syndrome, where people develop from using these high octane marijuana products, even for the first time, they'll develop intractable vomiting, where they cannot stop vomiting and they have to be hospitalized and rehydrated. This is a real problem and results in difficulty. Also, thinking about the impact cognitively. The problem with messing up the endocannabinoid system is that's the system that is there for us to encourage us to do the really hard things in life, keep us interested as children in learning to play the violin or learning to do their ABCs. That's hard, it takes practice. Most people would lose interest as adults, but it's this endocannabinoid system that rewards that child's brain. What we see when we overwhelm it with THC, and particularly high levels of THC, is that now that motivation is gone, that reward is gone, and the kids are no longer interested in doing those things. And we see them begin to fail in school. We see them begin to get more withdrawn from their friends. We see them lose interest in sports and other activities that used to be really important to them. So even though they may not have the disease of addiction and they may not go on to use it chronically, it's impacted their brains in ways that could have long-term effects. And because it is stored in the fat cells, it's stored in our brain, which is mostly fat. So even if we're not acutely high with it, it's still impacting our memory system. All of those systems that we saw in our brain are being impacted by the marijuana, the THC that's stored in our brain, that's going to gradually come out of our system but it will continue to have some impacts on those systems. So long-term use is worrisome, and it suppresses our pituitary, which means our pituitary gland isn't doing its usual job of monitoring our thyroid, our adrenal glands, our ovaries, our testes. So our hormone system becomes impacted by it. And this can create issues with depression, issues with fertility, all kinds of problems can develop. Again, aside from the disease of addiction. I hope that answered your question, Jonathan.
Yeah, let us know, Jonathan, if you have any more questions around that. So speaking of the long-term effects, I know that you have a lot of experience in long-term relationships with addiction patients. What kind of resiliency have you seen from people being a chronic marijuana user? Have you seen the physical side being able to get back in balance, or is it generally more of a permanent thing that you've noticed from the effects of marijuana?
Well, yes and no. How is that? Many of the physical problems seem to be able to be reversed in the first 6 months or so once the marijuana has truly gotten out of the system. We began to see liver more effectively operating. We began to see the immune system be better equipped. We see some of these things reverse. Sometimes we have to intervene medically to provide them with support so that their hormone systems can get back in balance. What is an ongoing problem can be the anxiety disorders and the disruption to sleep. And sometimes these can take a long time to normalize. And sometimes we do have to intervene with medications, with things like neurofeedback, with other kinds of modalities to help them get back to normal, because these systems have been disrupted. And there was a very interesting 30-year study that was done in New Zealand, looked at the impact of marijuana, started in the teens and throughout the life cycle. It was a naturalistic study. And what they saw was that there was, on average, an 8-point drop in IQ that was not recovered. Now, I'm sure most of our listeners, and certainly many people, can lose 8 points in their IQ and it not be that big a deal. But for at least half of our population, losing 8 points in IQ permanently is not a good outcome and can have long-term effects on career, long-term effects on the ability to be successful, finish college, finish high school. So the long-term use, even if it is not addictive, even if they are able to manage it, there are still ongoing problems.
Thanks so much. Sorry, I'm hijacking all the question time, but I don't see any other questions coming in. So I'll have this be our last question. I was recently working with a family, and this is a pretty common situation, where they were telling me about their young adults' marijuana use and how he has anxiety and ADHD, and that it really seems to be helping. But the alcohol was something that they were most concerned about, but the marijuana they weren't as concerned about. And I'm kind of getting into what we're probably going to talk about next week, but I'm sure that's something really common that you hear. How do you navigate that typically when people say, this is really medicating my mental health issues and seems to be working?
So here's the thing. Most people wouldn't drink or smoke pot or take pain medicines or sleep medicines or ADD medicines if they didn't help. They do help. They do help usually in the beginning, Lots of people discover serendipitously that if I smoke this joint, then I can go to the high school party and I'm able to interact with people. I'm a funny guy now, and people really, appreciate me, and I feel less anxious. And it does work. It really does. So the problem is that it doesn't work at the same dose. People begin to build a tolerance. They have to use it in higher doses more and more frequently. And then with anything that is addictive, what we see is that it's no longer making you high, making you feel good. You have to use it to just feel normal or not go into withdrawal. So what worked initially now has become a problem of its own. And we see that people have rebound anxiety. And so they have to drink more or they have to use more marijuana. There are ways to treat these disorders that don't have to include medications that you get tolerant to. You have to keep increasing the dose. There are ways to manage these illnesses that are much less impactful on you physically. And it doesn't have to be a medication necessarily. So there are safer, easier, more effective ways of managing depression, managing anxiety, sleep trouble, or pain that don't have to include these substances that then take on a life of their own and create a whole nother problem.
Yeah, that makes a lot of sense. And kind of the conclusion that I came to with that family is I recommended that they get a comprehensive assessment to determine if there is any underlying substance use issues, and then having a clinical team being able to give them some recommendations if there are. So, well, I think we'll wrap it up. Dr. Blank, thanks again, and thanks to all our participants. We hope y'all will join us next week. I'll send out an email with the information to everyone that joined us for the next week's presentation. And we also recorded this, so I'll be sure to send that link as well. But thanks again, wishing everyone a great week, and hopefully we'll see y'all again.
Bye.
Bye, thank you.